Well, Manny, thank you for joining us at our inaugural event here in LSI Europe. Tell us a little bit about what you've been doing.
Well, uh, Nick, it's great to be here. I just wrote a little note to Scott and wishing him well on this inaugural event. Continuing our work that we've been doing for the past 50 years, trying to develop a variety of implantable devices, things that never been done before. And the work that we're presently doing is in the field of developing an artificial coronary artery. And the way we are doing it is to create a device that we can implant in the body, and then with a period of time, somewhere around 9 months to a year, the product disappears, it's absorbed into the body, and leaving behind an artificial, I should say, naturally developed artery for the heart.
It's incredible.
And we're hoping to begin our first human studies in November, December of this year, keeping our fingers crossed and praying a lot.
Well, that's exciting. We're looking forward to hearing how that goes in the next coming months here now.
Yeah, we're excited. We're excited, we're nervous, and all of the above.
So, what makes what you're doing so important?
Well, if you consider the fact that one of the most common operations in the world is coronary bypass surgery, when you realize that between 2.5 and 3.5 million grafts are implanted, but taken out of the legs, off your arms, off your breasts, and we're trying to totally eliminate that by creating an artificial graft, it's important. We feel that we can reduce pain, scarring, time, injury, get better results. It is very, very important. We feel that in our country alone, in the United States alone, we would be saving $4 to $8 billion in costs per year. We feel that we will be helping worldwide a million patients per year. And I think that as a result, the quality of life of a patient will be better. And who knows, we might even be able to extend the life of a patient because he or she will have less trauma to their body, since we will no longer be harvesting the vessels from the body.
And it's my understanding that grafts are not just used in the heart, but in other parts of the body too. So, is that the future? Looking beyond the heart?
That's the future. I can't even look that far ahead because what we're tackling right now is so big that if I look beyond it, I'll get scared, and I don't want to get scared.
Or excited.
Exciting. We'll just take care of the heart right now until we can prove that it works, and then once that happens, sure, we'll have staff members that will continue to work so that we can use this device throughout the body.
Well, it's my understanding you've recently received a financial commitment recently. Do you want to talk a bit about that?
Yeah, it's interesting. We're trying to raise in the neighborhood of about $40 million. We're doing presently a Reg A financing that was with the help of Scott Pantel and his group, and in addition to that, we found a private individual who wants to be part of this and has committed $20 million over a period of time, so that can help us secure that, help us secure the financing that we need to complete this project. We continue to look. We're doing this Reg A financing so that the average individual, both accredited and non-accredited investors, can participate.
So I can invest today if I wanted to.
Yeah, we'll take your money.
Okay.
I'll put
We'll
my
talk
hand in
after
your pocket.
this.
Yeah, okay, sure.
Is there anything else you want to share with us with what you're doing right now?
Well, I think that people have to understand that we are constantly trying to see what areas of the medical part of the, particularly cardiac related, where we can contribute. Over the years, you may know that we have developed the first long life pacemaker when we started a company called CPI, which became Guidant, which is now owned by Boston Scientific. We started developed the first bileaflet valves, which became the standard of the world. The most commonly used valve in the world is the St. Jude valve that we developed about 50 years ago now. Then we developed other valves, and we have developed a variety of products. Fortunately, we've been able to finance those things. We've done 7 IPOs, initial public offerings, and we would be doing that again. However, we have tackled a project it's taken us a long, long time, namely the development of this graft, over 6 years now, and we still have no revenue. So it's difficult to do an IPO, but Scott and his people suggested, and we have begun this Reg A financing. But we will continue to take a look at a variety of different things. And as you said, once we start this in the coronary area, we can use this graft, we hope, in peripheral areas, in pediatric, a lot of different places in the body. And that's the contributions we like to make.
So you mentioned earlier when we were talking before we got set up that other companies have tried to build an artificial graft and implant it in the body. What are you guys doing differently that's going to make this a success?
Well, it is true. I mean, I get a great kick out of people say, Manny, how risky is this? And I said, well, in the last 50 years, a variety of companies, a variety of hospitals and healthcare centers have tried to develop an artificial graft. We're trying to eliminate this harvesting of vessels out of your legs and arms, and no one's been able to do it. The Medtronics of the world, the large companies, one of my old companies, St. Jude, also have tried to develop this. It's very risky. And in fact, in the same 50 years that we put a man on the moon, but we still have not been able to develop an artificial coronary artery. We have taken a different approach, and apparently that approach is working. We're using different materials, but we're also taking a different approach on how we are implanting this device. And as I mentioned before, it will be a device that will be implanted. Then our materials will be absorbed by the body, leaving behind a method by which a naturally formed artery will take place of our artificial artery.
What makes you keep doing what you're doing?
That question was asked of me by a young finance person who had just gotten his MBA from Harvard. And he said to me, Manny, why do you continue to do these things? Why aren't you playing golf? And I said, well, I was in Spain one day visiting with some surgeons, and they were talking about a heart transplant. And I said, gee, I've never seen a heart transplant. Any chance I could attend? And they said, are you going to be here this weekend? I said, yes, I'm not leaving Madrid until Monday. Well, then we'll do one this weekend for you. And I said, how do you know you're going to be able to do one? And the doctor went over to the window, and he opened up the window, and we were looking at a little plaza in Madrid, and everybody was driving around little mopeds and little scooters and things like that, and no one was wearing a helmet. And he looked at me and he said, on the weekend, it's even worse than this. He said, we will have a heart transplant this weekend. I said, okay. So sure enough, that evening, or maybe the following evening, they called me in the middle of the night and said, Manny, come on down. So I went to the hospital, went in, I gowned up, and then at the head of the table, I was watching them take out an old heart. But just as they were ready to take it out, an individual came in with a simple cooler, an igloo, a simple Coca-Cola cooler, an ice carrier. And he opened it up, and in a simple Ziploc bag, there was a heart with a couple of labels on it and things like that. And there was a little table. They took out the heart, they put it on the table, okay? And they checked the numbers, everything checked, and said, okay, let's proceed. And they started to take out the old heart. They took out the old heart, They put it on the table. And what was amazing was that when they put it on the table, it was still beating. And it started to slow down, but it was still beating. In the meantime, then they took the new heart and they were implanting it. And I was watching the old heart, and it was still beating, but slowing down. And then at a moment when the new heart was positioned and put in the proper place, they started to release clamps so that the blood would be going into the new heart. And as I was watching, all of a sudden the new heart started to beat. But at that very moment, and I mean the very same moment, the old heart stopped. And I said it was like life had gone from the old heart to the new heart. And I turned around to the young man, the young MBA, and I said, when golfing is as exciting as that, maybe I'll take up playing golf. And I don't think I'll find that. I think what we do is so exciting. You know, as a good Lord lets my brain still work and keep me in good health, we'll be doing fine.
It's incredible what you're doing, and you're right. It's exciting to see how medtech is changing people's lives.
Right.
Is there anything else you want to share with us before we let you get on with the day?
Yeah. Last night we had an opportunity to talk to some of the finance people that are at this meeting, and they, of course, are a major player, a major contributor to what we are trying to accomplish. Without the financing, a lot of these things would not happen. But again, I kind of emphasize that we all are taking risk every day. Next month, or I should say in November of this year, we will be asking some doctors to actually put a lot of risk on the table by asking to implant for the very first time one of our grafts on a patient. He will be taking risks, the patient will be taking risks, the hospital, a lot of people will be taking risks. And I'm trying to say to the finance people that I realize you are required to investigate or do the due diligence on the reviewing companies, but please have a little less adversity to risk. Take some risk. You will be helping a lot of patients, a lot of new companies, and believe me, at the end of the day, you'll be doing better than the present method of narrowing the possibility of getting venture capital. Broaden that base so that we can have more companies doing the things like what we're doing.
That's incredible. I want to thank you so much for doing our first interview here in Europe. I couldn't have asked for a better person to start talking to
Well, Nick,
for this conference.
Thank you, Nick, and thank you to the entire staff of LSI for letting us, the entrepreneurs, tell our half of the story.
It's amazing work that you guys are doing. You know, you're changing healthcare.
Okay. Thank you. Thank you very much.